To new information this evening in the local increase in Shigella cases. That is a highly contagious bacterial infection transmitted person to person through contaminated feces. Daisy Caballero's in the newsroom. So Daisy, what is the update from health officials tonight?
Well, David, it's important to note that most of the general public is not at risk here as long as they keep up with washing their hands. It's also not a new type of infection. In fact, Multnomah County has been tracking this for the past 10 years, but they are seeing a rise in cases this year and want people to be aware.
We would like people to not feel anxious in general, unless they're in one of the specific populations.
Multnomah County health officials are sharing new details on the increased cases of the illness called Shigella in the Portland metro area. Shigella is a highly contagious bacteria that spreads through fecal matter. We're told transmission most notably happens when getting the bacteria on your hands and touching your mouth, or through male sexual intercourse. And those most at risk are the unhoused community.
These cases can occur because bathrooms, hand washing sinks, and soap can be hard to access when you aren't housed. And unhoused community members are at higher risk of infectious disease in general as they experience poorer health than the broader public.
There have been more than 200 cases of Shigella reported so far this year in the Portland metro area. 45 of those cases have been reported this month alone throughout Multnomah, Washington, and Clackamas counties. And while county health officials say there isn't a clear geographic pattern for these cases, they have seen an influx in infections being reported from unhoused people that live in Old Town.
So we were forewarned in advance by some folks at the city.
Jessie Burke is one of the co-owners of the Society Hotel in Old Town and says this news has been upsetting to hear, but not surprising. She adds her hotel takes pride in keeping things spotless and hopes this doesn't stop people from supporting Old Town businesses.
We just want to assure everyone everything is fine. There is no reason to avoid this area. And you know, these things affect all of the microeconomy stuff, so just being thoughtful when delivering those messages.
Now, symptoms do include diarrhea, fever, stomach cramps, and sometimes vomiting, and can last 3 to 10 days. Now, if you do think that you have Shigella, you are asked to get tested and isolate immediately as it easily spreads. We'll have more details at kgw.com. David?